The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Hello, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. Last week I attended the ADPH Substance Misuse Summit 2025 down in Montgomery, and I'd like to do a little recap for you here. It was a very cool conference. I'd never been to it before. It's put on by mostly Auburn University School of Pharmacy, but also ADPH, Alabama Department of Public Health, also an organization called COACH, Center for Opioid Research, Education, and Outreach. I thought COACH was like an acronym, but I don't think that works. And the University of South Alabama was also associated with this, doing the CME part of it. It was held at a church down there called Fraser Church. And it was not what I was expecting. I was expecting like a small church with, some folding chairs and a little podium in the front of the room. This was like a mega church. It felt like walking into a mall or an airport or something. Super nice, huge, gigantic auditorium. Just looking around the room, I would guess maybe 200, 300 people attending. They had it arranged in tables, so there were tables with 5 or 6 chairs all around them. I think I'm going to interview one of the people who was at my table that I met for the podcast. That'll be super cool. The first presentation was by some different state of Alabama officials. We started off hearing Dr. Scott Harris, who's the Alabama State Medical Officer. He talked about the state's efforts to distribute Narcan, naloxone, through law enforcement and schools and county health departments. He said the biggest program that they've been working with is called the OD2A grant, which I had never heard of before. This is an agreement with the CDC. OD2A stands for Overdose Data to Action, which provides funding to 90 different health departments to help reduce drug overdoses and the impact of related harms. It started in 2019, and then they expanded it in 2023. Dr. Harris didn't really say a lot about specifically how the program works. According to the CDC website about it, it seems like it just requires states to track and report information about overdoses, morbidity and mortality associated with overdoses, and then it requires clinicians and health systems to participate in the PDMP, Prescription Drug Monitoring Program. There are some requirements for partnering with public safety entities for harm reduction and providing some links to care for people in the community. In Alabama, it looks like this is actually facilitated by the Alabama Department of Mental Health. Oh, which makes sense why the next speaker was the commissioner of the Department of Mental Health, whose name is Kimberly Boswell. The Department of Mental Health has a website that shows all the different initiatives and things that they are actually doing. So I'll put a link to that in the show notes. Miss Boswell, or maybe it's Dr. Boswell, I'm not sure, talked more about what they're doing with the opioid settlement fund money. This settlement came about as a result of, it seems like a bunch of different states filing litigation against a bunch of different pharmaceutical companies and distributors. And eventually they just kind of rolled it all into one thing, and that turned into this gigantic settlement that each of these companies are going to pay out to the states. It ends up being like billions and billions of dollars over a period of years that is coming from pretty much all of the big distributors and pharmaceutical companies that we've all heard of. I'm just looking at the actual National Opioid Settlement website. Distributors are McKesson, Cardinal Health, AmerisourceBergen, manufacturer Janssen, and its parent company Johnson & Johnson. And then pharmacy chains, CVS, Walgreens, Walmart, a couple more manufacturers, Allergan and Teva. It's pretty wide-ranging, and it's a lot of money that's coming into the states over the next few years. So Commissioner Boswell talked about how the Alabama Department of Mental Health is utilizing that money. They are spending it on preventative measures such as fentanyl test strips, I assume for use by law enforcement, more Narcan distribution, naloxone, medication take-back program, as well as treatment services for individuals. Here in our area in Huntsville, until recently, there was not any kind of inpatient detox program for people addicted to substances, and so they've established that at Wellstone, which is right down the road from my house. They have 16 beds available now for inpatient detox, Commissioner Boswell also spoke about 988, which is the emergency phone number for mental health crisis, which I'm embarrassed to say I had never heard of before, but 988 is the emergency number for mental health crisis. It's like 911 for mental health issues. Apparently that's been around for almost 3 years. It was required to be implemented nationally in July of 2022. So Alabama's using some of the opiate settlement money to expand that program. It's a national network, so evidently just because you call 988 from Alabama doesn't mean you're going to necessarily be connected to somebody in Alabama, but the goal is for them to increase the percentage of time that someone in the same state is actually answering the calls from the state. So the goal is for 90% of calls to be answered by somebody in the same state. And I believe she said last year we were up to like 87% or something. So they're almost at their goal on that. She also mentioned that they have more money to give to programs involved in preventing substance misuse. She said when they put out proposals last time, they actually didn't get very many, or they didn't get as many as they thought. Currently, they have something like a $3 million surplus that they would like to give out to prevention programs. So if you are involved in something like that, or know somebody who is, or would like to be, keep an eye out for the next time they request proposals for grants. The next speaker was Clay Crenshaw, who's the Chief Deputy Attorney General of Alabama. He talked more about how Alabama was involved in the big opiate settlement. He threw around a bunch of numbers, but I think he said that so far $824 million has come into the state as a result of that litigation, and maybe we expect about another $285 million. He said that Alabama does still have some litigation ongoing with Purdue Pharma, which is the Sackler family. Evidently, our state did not choose to partake in some of the large national settlements and chose to continue pursuing our own litigation. And Mr. Crenshaw said that that's probably going to end up being a better deal for us. The state is probably going to end up getting more money because of that. So yay, go Alabama. One thing that just stirred me a little bit is apparently most of that money goes into the general fund for the state legislature to decide how to spend it, which in my mind means it's maybe not going to be spent very intelligently, or it's going to go into somebody's pocket, part of it. I don't know. I didn't love that. But there's also an effort to split the money with individual cities and counties and not just keep it at the state level. So it'll be interesting to see how much of that money actually funnels down to doing something for people. But evidently the Department of Mental Health is using it for appropriate things. So that's good. Mr. Crenshaw and several of the different speakers actually touched on how big of a problem the opiate epidemic really is and has been in Alabama. I've heard that the epicenter was here, but the numbers that they were throwing around were pretty shocking. Like, for real, Alabama was the highest number of opiate prescriptions per number of people in the population, like in the whole country. Like, we were number one for that. And we're still more than almost every other state. As of 2023, I believe Arkansas had higher numbers than us, but we're still right behind them. So still a big problem down here. And the number that another speaker gave was that in 2023 in Alabama, there were 71.4 opiate prescriptions written for every 100 people in the state, which sounds like quite a lot, but apparently that's way down from where it was. One of the later speakers said that in the past, we used to have 5 opiate prescriptions written for every man, woman, and child in the state of Alabama. That is unbelievable. I know a few years ago, a physician here in Huntsville got in big trouble for inappropriate opiate prescribing. He was the number 1 prescriber in the United States, according to Medicare data, of Schedule II controlled substances. That is not what you want to be number 1 at. So maybe just stopping his practice put a huge dent in the statewide numbers, I would think. The next presentation was by a DEA agent, actually a DEA group supervisor. I feel like I shouldn't say his name. I don't guess it's a secret, but it just seems like the right thing to do. I don't know. After he finished speaking, a person in the crowd asked him if he was being targeted by the cartel for even showing up to speak. And the guy mentioned a very specific cartel name. I didn't catch what it was, but he was like, are you being targeted by the Windua cartel even just for being here today? And I thought, that's a weird question. And the speaker kind of laughed at it too. He said they have bigger things to worry about than me. So it probably doesn't matter if I say his name on this little podcast either, but I just feel like I shouldn't. So anyway, it was a DEA guy. In Alabama, you have to go through a course like this to be able to start prescribing controlled substances. And one of the presentations they always have at that initial course is from somebody from the DEA. And I guess it's just to scare you, or to give you the message that they are paying attention, because that presentation is usually about what you do when the DEA shows up to raid your office and how you're supposed to like be nice to them and give them a cup of coffee and don't act weird. It's kind of an odd presentation. Like, it's interesting. It's interesting to hear that perspective on things, but the whole vibe of it is like, hey, we're coming to get you if you screw up. This was not like that. And this is not the same DEA agent that's been at every one of those other presentations that I've been to. He was mostly talking about fentanyl specifically and what's going on, what they're seeing out on the streets. It surprised me to learn that fentanyl is the number 3 most common drug involved in offenses that the DEA tracks. Number 1 is still methamphetamine, and number 2 is cocaine. But the speaker was anticipating that fentanyl is probably going to rise to the top of the list pretty soon because they're seeing so much of it. I don't really know much about the illicit fentanyl trade. Of course, we use fentanyl on the ambulance and in the hospital, but that's my only experience with it. He said that the most common forms that they see on the street are powdered form and then in fake Oxycontin pills. The ones that he showed pictures of are called M30 tablets. They actually have M30 stamped on them. Evidently, this also commonly comes in tablets that look like Xanax or Adderall, but are actually fentanyl. He says that the purity of the fentanyl they're seeing on the street is increasing. He talked about a New York Times article where they were embedded with the manufacturers of illegal fentanyl down in Mexico somewhere. And I'll put a link to that in the show notes. Of course, with New York Times, you have to be a subscriber to read their stuff. So if you happen to be a subscriber, or if you would like to subscribe, you can check that out. It looks like they did a really long series about this over the last couple of years. But one of the things he was saying that came out in that article is the method they use to test the purity of their fentanyl that they're making. Apparently, they inject their product into chickens, and if the chicken dies within 1 minute, that means that it's strong enough. If the chicken does not die within a minute, that means it needs to be more potent. That's pretty scary. He talked about rainbow fentanyl that's made to look like candy. He showed a bunch of different pictures of gummy bears and things that look like sweet tarts, but they're all actually fentanyl. The DEA considers a potentially fatal dose of fentanyl to be 2 milligrams, which kind of surprised me. I guess I thought it would have been more, although the doses that you typically give for pain relief are 25 to 50 micrograms at a time. So that is a huge dose. I just looked up the LD50 of fentanyl, and it seems like it's kind of all over the place. One thing says 3.1 milligrams per kilogram in rats and 0.03 milligrams per kilogram in monkeys. That's a huge difference. The DEA's drug and chemical evaluation form on fentanyl, or actually on acetyl fentanyl, says the LD50 of acetyl fentanyl in mice is 9.3 milligrams per kilogram, and of fentanyl is 62 milligrams per kilogram. I wonder if they put the decimal point in the wrong place. 62 milligrams per kilogram is the LD50, and they're saying that 2 milligrams is a lethal dose for human. That doesn't seem right. I feel like there's a typo there. So I don't know, just for fun, let me use the 9.3 milligrams per kilogram of acetyl fentanyl for a 70 kilogram person. That would, these numbers don't make sense. I don't know what they're going by to come up with that 2 milligram number. But anyway, that's what they say. 2 milligrams can be a fatal dose. And apparently a lot of the tablets, or a lot of the single doses that they find on the street, contain 2 milligrams or more. So essentially they're saying you could die from taking a single dose of fentanyl. Based on what they've tested, the average concentration of fentanyl is 2.9 milligrams in a tablet. So he was saying that about half of the pills they test have that potentially lethal 2 milligram dose. I have definitely seen, especially working in PACU, where we give fentanyl to people who just came out of general anesthesia, 25 or 50 micrograms is definitely enough to stop some people from breathing in that situation, which obviously they've had a lot more medications on top of that. More than a handful of times I've had to suddenly jump up and start bagging somebody because I gave them a dose of fentanyl and they just quit breathing. So weird numbers notwithstanding, I know it's strong stuff. Anything that's dosed in micrograms, you know that it's potent. Street value of fentanyl is about $800 to $1,000 per ounce. Here in this area, a pill will cost $3. At the border, it costs 40 cents. So not much of a financial barrier to getting this stuff. He talked about some things that get added to the fentanyl or mixed with it. The most common agent that's used as a binding agent in the tablets is acetaminophen. He didn't really say how much acetaminophen typically is in a dose, but obviously that can be harmful as well in excessive quantities. There's a different medicine called xylazine, Xylazine, which is a non-opiate sedative that's used in veterinary medicine. It's like the proverbial horse tranquilizer. It's super potent and it's not controlled. I guess you can just get it from any veterinary office or wherever. So apparently that's mixed with the fentanyl a lot in order to make it more potent. There's this other opiate he mentioned that's called isotonitazene, isotonitazene, also known as nitazene or ISO. This is a synthetic opiate that's very similar to fentanyl. It is a Schedule 1 medication in the United States, so illegal under all circumstances, but he said it's often not tested for, so they don't feel like they have a good idea really of how much is out there. Especially in EMS circles, there's been this kind of jokey phenomenon about police officers freaking out about potentially being exposed to fentanyl. There are these videos where it seems like, and I'm of the opinion that you can't trust anything that you see online anymore, but there are these videos out there of all these police officers supposedly going unresponsive from being exposed to fentanyl. And I think the general consensus is that it's kind of like mass hysteria, like they're all terrified of being exposed to it, and it's this whole thing. He actually referred to that, and he didn't go really into detail about it, but he said, you're probably fine if you get exposed to fentanyl. One thing he said that I did not know is that hand sanitizer actually facilitates transdermal absorption of fentanyl. So if you're handling tablets or whatever, and then you try to use hand sanitizer to clean your hands, it's actually going to cause more absorption. He talked about federal sentencing guidelines where they're now pushing for 20-year sentences for drug dealers if someone's death is linked to the drugs that they sold that person. And we've seen that lately in a couple of high-profile situations. I think they arrested the people who provided the medication that killed Matthew Perry. And I think I heard something about that with the guy from One Direction that died recently. His name was Liam Payne. He also talked about there are these fake online pharmacies popping up. These are websites mostly based out of the Caribbean and India that look like legitimate online pharmacies where people can actually go and just purchase illegal drugs. He talked about the DEA's efforts to combat that. They did this whole operation called Operation Press Your Luck, and all the information about it is available online. I'll put a link to that in the show notes. They have all these pictures of the different machines that were being used to manufacture tablets and all the different forms that it was being manufactured in, and about how much substance they confiscated, how many people were charged, etc. So that's kind of interesting. He mentioned a DEA resource called Together for Families Network that looks like they have a lot of different resources for both individuals and organizations. He mentioned that in general, just as far as overdose deaths from all causes, we have seen a decrease in that for the first time since 2018. That's both nationally and in our state, so that's good. At least I assume that's good. Sometimes with those statistics, like it sounds good, but then you look into it and it's not so good, so I'm just going to assume that that's good. The next speaker was a gentleman who is in long-term recovery from substance abuse himself, and he's kind of turned that experience into a career working with people in recovery. His name's Ben Spellman. He's a licensed therapist who works with that population, and he mostly just talked about his personal journey with substances. He talked about how he went from getting prescription pain medicine to then getting heroin, and he also abused alcohol. It was definitely a moving story. It's neat to see somebody who has risen above that and ultimately been successful just in life in general, despite having to overcome that. I don't know that he really had much practical advice for clinicians. In fact, I stood up and asked him a question in front of all those people about what somebody like me can do as a clinician to be helpful, and he really didn't have much of an answer. I was kind of hoping for some personal story of how a clinician either did something helpful or did something very unhelpful that he could share with us, but he didn't really have much to say from that standpoint. The gist of his answer was don't be afraid to confront people or kind of hold up a mirror to them and try to help them think about and see their own situation, their own behavior, and acknowledge that. One thing he said that kind of stood out to me is that your actions show what your true beliefs are. He said, think about if someone watched a video of everything that you do for 24 hours without any audio, what would they think your beliefs are? I thought that was pretty neat. He was talking about that in the context of dealing with deceitful behavior from somebody who is an addict. His advice to parents of kids who are possibly struggling with substance abuse is to keep an eye out for plausible but untrue explanations for things that you just know are not right. Sometimes you just kind of have a feeling that you're being lied to or that whatever somebody's saying doesn't really make sense, even though it kind of could make sense. He said that's a big tell. And then he said, follow the money. He didn't really elaborate on that. I guess he meant just keep an eye out for how your kids are spending their money or how much they're spending, where it's going, etc. He mentioned a specific organization called Caduceus, which is a group specifically for medical professionals who are in recovery that he used to work with that he thought was a good organization. The next session was about the PDMP, the Prescription Drug Monitoring Program in Alabama. That's our system where we can look up our patients and see all of the controlled prescriptions that they're filling. We can tell who prescribed it, where it was filled, and we can see if they're doing anything questionable. The only new information that came out of that, he mentioned that anytime EMS administers Narcan to a patient, that's going to be reported in the PDMP, or I guess that's already being reported in the PDMP. So that might tip you off that perhaps they're overdoing it with the substances, or you're overprescribing the substances. Of course, and he pointed this out as well, just because somebody gets a dose of Narcan doesn't necessarily mean they have overdosed. It's not uncommon to give Narcan to somebody just because they're unresponsive without really knowing if they overdosed on something or not. So not a 100% deal, but that is another key piece of information that I would definitely want to know as a clinician, as a prescriber. The next presentation was from Dr. Cherry Jackson. She is a PharmD teacher at Auburn and also UAB who kind of specializes in psychiatric pharmacology. Her presentation was about how there's a lot of correlation between mood disorders and substance use. She talked about some different theories of why and how that is. She framed it as being kind of a chicken and egg situation, like, does the mood disorder cause the substance abuse, or is the person using substances to try to self-medicate because of the mood disorder? There are three big theories about this. One is called precipitation, meaning that the substance abuse is what causes the mental illness. The self-medication theory is that the substance is used to treat the mental illness. And the third is called shared vulnerability, meaning that for whatever reason, a person just has underlying susceptibility to both of these things, whether that be a genetic thing or environment that they're raised in. Nature versus nurture, right? Her presentation was really dense and felt really long. There's a lot of information. Some of the things I picked out are that she pointed out that brain changes that you see with substance use over a long period of time are similar to brain changes that you see in people with mood disorders. So over time, there really is a lot of overlap as far as just physical changes in the brain. She mentioned that we're seeing more cases of psychosis actually leading to schizophrenia from marijuana use, as in like the first time someone uses marijuana, they experience psychosis. And from what she said, we really don't know what's behind that. We don't know much more about it than that, but that's what they're seeing. Current practice, when you have both a mood disorder and a substance abuse issue, is to treat both concurrently. In the past, they used to focus on getting the substances out of the body first and then focusing on the mental health issues, but now they're trying to address both things at the same time. The keynote speaker for the day was Dr. Ben Carson. Yeah, that Dr. Ben Carson. Even driving down there the night before, in the back of my mind, I was like, this is just going to be some rando named Ben Carson. Certainly the Ben Carson is not coming to speak to us here in Montgomery. Lo and behold, it really was him. I guess I was kind of vaguely aware of him as a past presidential candidate and as the Secretary of Housing and Urban Development under Trump 1.0. Apparently, there's some thought that he may return as HUD Secretary under Trump 2.0. And I was kind of aware of him as a controversial, very conservative kind of figure, which definitely doesn't align with my political beliefs. But aside from all that, the guy is this super legendary neurosurgeon. His list of accomplishments in the medical field is just astounding. I guess he's best known for doing these high-profile operations of separating conjoined twins all over the world. And it's just kind of neat to be in the room with somebody like that, Like, even if you disagree, just breathing the same air as somebody who's accomplished all that and who's that famous, it just feels special. It feels like a big opportunity to hear what somebody like that has to say. I don't know that he really said anything particularly applicable or useful, and I'm not even really sure why he would be the keynote speaker at a substance abuse conference. As far as I know, he doesn't have any particular expertise in that field. But he also didn't have any particular expertise in housing and urban development before he got to be the secretary of that. So it's not always about what you know. But he spoke for over an hour. He speaks very slowly and moves very slowly. I don't know if that's just him or if it's age. He's 73 years old. But it was sort of the same vibe as watching President Biden, like, I wonder if he has, Parkinson's or something and is taking medicine for that. But he did this bit during his talk where he asked the room who remembers what they had for breakfast, and everybody raises their hand. And then he recites the neural pathway of everything that has to happen in the brain in order for a person to raise their hand, like very quickly. And it's the whole, every nerve fiber and every part of the brain. And it takes a while. And it was very impressive the way he went through that. The nucleus accumbens to the pulpus and bubbles. I don't even know those words, but it was just, and that was a moment where I was like, oh, okay, he's still got it. He's still there. His talk was kind of a weird mix of actually very compassionate attitude about people suffering from substance misuse, kind of blended with what you would expect from a very conservative, very Christian kind of person. He went off on this tangent about how he's only ever slept with his wife in the context of being threatened with a paternity suit at some point. I don't know what that had to do with anything. He didn't really say much about politics. He made it clear that he doesn't think that just building housing for people who need houses is a strategy that's going to work. And according to this article that I just read about him maybe coming back as HUD secretary, the fear is that he would cut a lot of funding for the department and kind of reverse some Biden era policies that have been made in that direction. He cited some statistic about how 99% of people who go into provided housing end up back on the street because of drugs or whatever. And I don't know, who knows where he got that number. After his talk, somebody in the crowd asked him about fluoride in the drinking water in the context of Robert Kennedy potentially becoming the Health and Human Services Secretary and attacking that. And Dr. Carson said, it's not as crazy as it sounds. We don't really have any great studies about whether fluoride's any good or not, which sounds wrong to me. I'm not an expert about this. Just from a cursory Google search, it seems like we have pretty good data that fluoride is good for dental health, but we also know that if you get too much of it, it can affect neurological development. So I don't know. I guess we'll see what happens. I will say that you're much more likely to trust somebody when you're listening to them in person, and also much more likely to kind of let your guard down and like somebody when you're listening to them in person. He got a standing ovation just walking on the stage before he ever said anything, just because of who he is and all that he's accomplished. And so he walks up to the podium and he goes, I like coming down here to Alabama. People down here just have common sense. I fell for that hook, line, and sinker. I was like, oh, he won me over. We love him. It took me maybe 30 minutes to go, wait a minute. He probably says that everywhere he goes. The last speaker of the day was Alabama State Representative Joe Lavorne from Lee County. He was there to talk about the Price-Hornsby Act. This is a bill that he wrote or sponsored, or whatever the correct term is, that requires drug education for students in public school between 6th and 12th grade. This came out of the death of a teenager in Auburn named Price Hornsby. Representative Lavorne is a retired Auburn firefighter. He was a battalion chief at Auburn Fire, which he said like 300 times. But he actually ran the call where this kid died from a fentanyl overdose, and that kind of led to him pushing for this bill. This has actually already been written into law. It went into effect in June of 2024. It doesn't seem like the state is actually doing anything to implement this. This is essentially a mandate with no funding, so it just requires this of each individual school district, but it's up to the district to figure it out. My thought that I wrote down in my notes was, did we just invent DARE again? My impression is that the whole DARE program, which I definitely participated in when I was a kid through my school, is generally regarded as not a success. I guess it's still around, but a lot less prominent, a lot less funding put into it than there used to be. So as far as I can tell, there's nothing in this bill that's any different than that. And it doesn't specify what curriculum is supposed to be used. He did emphasize that it's supposed to be research-based instruction. I'm looking at the text of the bill, and it does say that. And I was glad to hear him say that because, otherwise, especially down here, you'd probably get all kinds of religious-based, something akin to abstinence-only sex education, or you're going to hell if you use drugs or whatever. After he said that, the other note I wrote down was, I wonder if he voted for the SB 129 bill that banned DEI efforts in public education. And I tried to look up how he voted, but apparently it was a voice vote with no record of how individual people voted for it. One thing he brought up was these Dispose RX packets, which are these little packs that you can use to mix medicine into and then dispose of them. He was out of town and went to a pharmacy somewhere to get a prescription, and they dispensed one of these packets along with the medication. He thought that was impressive. And then somebody else in the crowd got really excited, and I guess whatever organization they are with also dispenses these things. So just a little tool that can potentially be given out to people getting prescriptions for controlled substances so that you don't have a bunch of extra medicine laying around for somebody else to steal or abuse or overdose on or whatever. So that's a pretty good summary of our day at the Substance Misuse Summit 2025. It was interesting. It was neat to hear so many prominent people talk about what's actually going on. And I don't guess I really learned much clinically, but it was neat to hear all the information about the funding and the state efforts and all that I really was not aware of or don't pay much attention to. I'll put links to all the things that I talked about in the show notes. They sent out an email with the individual speakers' slides that they used in each of their presentations. I don't guess it's against the rules to distribute that. So if anybody's interested, if you want to email me, I can email you whatever you want from those slide sets if you want to see specifically what people presented. If you have any other questions or comments, please get in touch. Special thanks to our Patreon supporters. I hope you all have a good week, and I'll talk to you later. All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order.